Health Minister Dr. Joe Phaahla is calling for responsible behaviour and stronger compliance with COVID-19 protocols during this festive season. This as the country continues adjusted level 1 lockdown restrictions. He says, according to scientific studies, the Omicron variant is spreading quicker than in previous waves, but the rates of hospitalizations and deaths remained relatively low. Our reporter Heidi Giokos joins us now for more on this. You were listening to that briefing by the Health Minister as well as the NICD. Just tell us a little bit of what they said, Heidi. What should we be concerned about?
So at this stage, Masego, the big concern is the fact that Omicron is highly transmissible. This is something that, yes, we did see, for example, with Delta, but not as transmissible as what we are seeing with Omicron. So that seems to be some kind of concern for the Departments of Health and the NICD, who monitor these statistics and this data that comes out every single day. But what the silver lining in all of this is that the hospital admissions aren't as high and aren't as severe as the two previous waves, and the death rate is a lot lower than what we saw during the second, which was the beta wave, and the third wave, which was the delta wave. So this is some kind of encouraging news. We also saw Discovery coming out in the week saying that according to their clinical trials and their members being tested and analysed, they have found that this wave is going to be a lot milder, and many were expecting around this time next week sometime Gauteng was going to peak and it was going to be quite serious in terms of infection rates. But even though infection rates remains high in Gauteng, other provinces are also starting to experience a peak and very high numbers of COVID-19 infection. But the positive is hospitalization is low and death rate remains low. Let's listen to the Health Minister on that.
Over the last 7 days, we have seen a 70% rise in hospital admissions, though in absolute numbers, as I've mentioned, it's a high percentage because we come from a low base. But in terms of absolute numbers, we're still at a fairly low level, just over 7,600 patients admitted as a result of COVID. Now, in comparison of the fourth wave, when you compare with the previous waves, the weekly average hospital admissions are definitely much lower than the weekly admissions in the third wave. And as we will see, during the first 2 weeks, when you compare the first 2 weeks of the fourth wave and the third wave.
Speak to us more about these hospitalization rates.
Yes, so what we saw during the second and the third wave, Masego, was that those 60 and above, 50 and above, even 40 and above were being hospitalized. And those that were being hardest hit by COVID-19, needing oxygen and ventilators, were the 60 and above, the most vulnerable age group. And that's had a lot to do with the fact that people were not vaccinated at the time. And we do know that the biggest issue that we had with the third wave, with the Delta variant, was that there was a desperate need for oxygen and many people were placed on ventilators. But this time around in the fourth wave, a lot more people are vaccinated, and especially the vulnerable age group, so the 60 and above. Those that are being targeted, that are being hospitalized, are the younger population, so under the age of 19 and under the age of 5. During the third wave, it was only 5% of hospital admissions that were attributed to the younger population, and now, to the older population. And now with the younger population, it's over 20%, those under the age of 19 and under the age of 5. So this is a concern for the Departments of Health and NICD, but what is comforting and the positive out of this is that it's not severe. So there's no desperate need for oxygen or ventilators or severe illness where people are getting very sick, needing ICU and needing or passing on from COVID-19. So this is the positive with the hospitalizations. It's a lot less than what we saw, and this is also why South Africa remains on adjusted level 1, because government is saying hospital facilities aren't that constrained. But let's listen to the NICD on that.
we're seeing this rapid increase in the case numbers, but then the hospitalizations are not increasing as at such a dramatic rate, and we're really seeing very small increases in terms of the number of deaths. And this is really just the excess deaths from Gauteng, where with previous weeks, we've always seen this peak in the excess deaths, very much mirroring the peak in cases. And you can see very low numbers in terms of excess deaths in Gauteng for last week.
Well, we heard from the Minister in the Presidency in the interview I had previously that the NCCC is meeting Monday or Tuesday. Should we be scared?
Jab and jive, Maseko. I'm going to repeat it, jab and jive. So the message is very clear from government. It's the responsibility of each South African to be careful this festive season, to make sure that you adhere to all the COVID-19 regulations. The NCCC will most likely meet on Monday and Tuesday to further discuss the COVID-19 numbers. We do know it's highly transmissible, but this doesn't seem to be a determining factor for government. Even though our cases are shooting up and we're having over 20,000 cases per day, hospitalization and deaths is exactly what government is looking at. And if that remains low, hopefully we'll have we'll have a lockdown-free Christmas. But the message from governments is that what they are finding is that hospitalization is mostly in the unvaccinated or those that only have one vaccination dose, not two, which just shows you that there is some kind of protection against severe infection. So again, jab and jive and act responsibly.
Well, I'm jabbed, so I'm definitely jiving. It is December. Thank you very much, Heidi Giokos.